Jones. I'm a family nurse practitioner student at Urgent University. Today I will be doing a comprehensive head-to-toe assessment on Miss Amanda Smith. She's a 23-year-old female. Prior to starting this assessment, I've got a height on Miss Smith, a weight. I got vital signs on her, and I calculated her BMI, which was within normal limit. At this time, I'm going to have Miss Smith ambulate to the table so we can assess her gait. Her gait is within normal limit. Now you can see right here. So today, as we examine Miss Smith, I'm going to ask a series of questions about her past medical history, which is a part of the assessment also. Miss Smith, are you in any pain today? No. Okay, Miss Smith is not in any pain. Do you have any allergies? No. She has no known drug allergies. Are you on any medication? No. She's not on any medication. What about your past health history? You've been hospitalized for anything? You do have one child, right? Okay, so she's gravid one, para one. When was the last time you had an oral intake? Food or drink? About an hour ago. Okay, our last oral intake was about an hour ago, and she's in no acute distress. As Ms. Smith, you can see that she is completely oriented, so a level of consciousness, awake, alert, oriented ×3. Her face is without blemishes, no pimples, her skin has no discoloration, no pimples, no breakdowns, so her skin is intact. We look at her hair is full, it's thick, it's evenly distributed, and so from there I'm going to assess her skull. And to do this, I'm going to just go in and just take a look. And what we're looking for, we assessing for any palpable masses or nodules, and there seems to be no palpable masses or nodules in Miss Smith's hair. And from the hair, I'm going to assess her nails. So let's see your nail beds. Her nails are slightly brown, they're convex. Checking our capillary refill time, and it seems to be less than 3 seconds. It returns with the Blanch test. It returns to its normal state within 3 seconds. I'm going to test her skin turgor. Her skin turgor is also within normal limits. It's within 3 seconds. So after we assess Miss Smith's nails, her skin, I'm going to look at her eyebrows. Her eyebrows are evenly distributed, the hair is even, they're symmetrical, no lesions or anything, they're thick, and they look symmetrical to me. From her eyebrows, we go to her eyelashes. Her eyelashes are evenly distributed, no signs of any infection or anything like that. The next thing we're going to assess is her eyelids. I'm going to get my gloves. You always want to use precautions when assessing any orifice that could introduce infection or anything. So when we look into our eyelids, we see variable capillary beds or pink, evenly distributed, no signs or symptoms of infection, discharge, or anything like that. And so now we're going to assess cranial nerve number. Okay, let's do cranial nerve number 1, which is the olfactory nerve. We're going to assess her sense of smell. And for that, I'm going to use two different aromas. Aroma number 1 and aroma number 2. And I'm going to ask Ms. Smith to close her eyes and tell me what she smells as I cover one of her nostrils. I'm going to place it on a Q-tip so that I can allow Ms. Smith to smell. Okay, close your eyes for me. Okay, breathe in. Breathe in. Okay, tell me what you smell. Okay, now we're going to assess the other side using different Q-tip. And so we have our second fragrance. And let's breathe in. Okay, tell me what you smell. Okay, so cranial nerve number 1 is intact, and that's the olfactory nerve. On the first one, she smelled vanilla, which was one of my aromas, and the second one was lavender. So the next thing we're gonna do, we're gonna test cranial nerve number 2. And for cranial nerve number 2, which is the optic nerve, we're gonna do the smelling test. And for the smelling test, we're gonna have Ms. Smith to read this chart. And on this chart, we'll test her visual acuity. So Ms. Smith, can you read like the second line for me?
TF.
Okay, the next one?
CFTZ.
Okay, the next one?
LOPDE.
Okay, the next one?
NTFLCZ.
Okay, the next one?
FEZPDT.
Okay, and the last one?
ECTPNL.
Okay, so with the smelling chart, this is the smelling chart. We have just assessed cranial nerve number 2, which is her visual acuity. So what that means is Ms. Smith, the top line is the distance, and the bottom line is the normal eye vision. So Ms. Smith's vision is 20/20 bilateral. Okay, so what I'm going to do, I forgot one thing. I forgot to have Ms. Smith to read it with her eyes covered. So can you cover the right eye? Okay. Read the lines.
So E.
Yes.
TLNP. CFTZ. LOPDE. NTFL. CZ. PEZ.
Yes.
FEZPDT.
Okay. I'm sorry.
ECI.
Okay. Now we're going to do the other eye. So that was her right eye. So we're going to do the left eye.
ETLP. NPD. CFTZ. LOPDE. NTFL. CZ. FEZPDT. ECTPNL.
Okay, good. So that was, thank you, Ms. Smith. That was cranial nerve number 2, using the smelling test to assess her visual acuity. The next one we're going to do is going to be cranial nerve number 3. And for this one, we're going to use a pen knife. And we're going to check the constriction. Okay, so this is my pen knife. And Ms. Smith, I'm going to ask you to raise your eyebrows. Raise them up and down. Okay, that's the oculomotor, which is cranial nerve number 2, and that allows a person to move the eyelids up and down. And so with cranial nerve number 3, I'm going to ask Ms. Smith to follow her eyes downward. Okay, so cranial nerve number 3 is intact. After cranial nerve number 3, we're gonna assess cranial nerve number 4, which is the trochlear nerve, and this is the ability for the eyes to converge. And we're gonna do that using a pen. Well, I actually did it with the pen light. I test her ability of her eyelids to her eyeballs to converge downward. I would usually do it with a pen. So that's cranial nerve number 4, and she did move her eyebrows up and down. So cranial nerve number 4 is intact. Cranial nerve number 5 is the facial nerve, and for that one we're going to use cotton ball. We're going to use cotton ball and a Q-tip. And with this one, I'm going to ask Ms. Smith to tell me when she feels, whether she feels something soft